And welcome to the operating room at Deuk Spine Institute. It is December 5th, 2023. Our patient here is having cervical disc surgery for herniated disc, C5-C6. His diagnosis is neck pain, arm symptoms with weakness and numbness, mostly arm symptoms. He has a herniated disc with a bone spur at C5-C6 on the right side. We're going to be approaching the disc from the left. I always go opposite side. The first thing to do is to get to the disc safely, and we do that using an X-ray machine to help me navigate. All right. Shot. 2, 3, 4, 5, 6. Need to be a little bit more north. And shot. There's a slight area just between the soft tissues, the trachea, esophagus, carotid sheath. Tiny, tiny little corridor that I can pass through with this needle in order to get to the disc. Perfect. Lateral. You can see we're in the middle. Shot. So we're going to pass through these soft tissues. Shot. Now we're right on the front of the disc. Let's get an AP, make sure we're in the middle. You want to start in the middle of the spine, middle of the disc. That looks pretty good. A little bit to the right. I'm going to reposition just slightly. Shot. Shot. All right, let's get one more AP, see where we are. It's important to check your lateral and AP views both. Shot. Perfect. Dead center. I'm going to pass through the front of the disc and into the middle. Okay, so I felt the needle go through the annulus. People ask me all the time, when you push your needle through the annulus, are you damaging the disc? The answer is no. When you push a needle through your clothing on your lapel for a pen, like a commemorative pen or a safety pen, are you damaging your clothing? The answer is no. You're pushing the needle through the fibers. 2, 3, 4, 5, 6. Everyone agree 5, 6? That's the proper level. We'll do a discogram. Not much dye is coming out. Let's get the shoulders. Shot. All right, let's see if I can't. It's very scarred up. Shot. There we go. Much better. All right, keep that one. Sanjay, can you see that? Or Henry, can you see that nice lateral view?
Yes, we can.
And show us the herniation there. Yes, there it is. You can see the dye wrapping around the back of the herniation. Okay. That was our discogram. It is not an evocative discogram, it's a chromodiscogram. There's a difference. Chromodiscograms, you're not eliciting a pain response from the patient. We're not doing this surgery for neck pain. We're doing this surgery because the nerve is being pinched at C5-C6. Our patient travels here from Michigan. No, he's not. I think he's from Michigan, right? He has a house here as well. Well, one of our surgery patients is from California today. The other one is, I believe, from Michigan. So, all right. So we've made our incision. It's about 5 millimeters. And now I'm going to leave the guide wire and remove this needle. Is that your shot? There we go. Good. Yeah. Henry, let's show the audience. No, we don't need it. Let's show the disc height as well, preserved. It's only the collapsed ones we really need it. A little distraction. Shot. Henry, show the audience how does a disc herniation cause neck pain. Now this patient's main problem isn't neck pain. His main problem is weakness and numbness in his right arm from a pinched nerve. From the herniation, show our audience how a herniation does cause neck pain. So people who have neck pain from a herniated disc, About 90% of chronic neck pain comes from a herniated disc. Let's show our audience how herniated discs cause neck pain. Shot? Welcome back. Now you can see how a herniated disc causes so much neck pain. It's a tear in the back wall of the disc. And right now, if you're watching our x-ray, you could see the dilator is being passed through the center of the disc, where the jelly is, to the back, where the herniation is. And now the tip of the dilator, Jordan, show us the tip of the dilator is sitting. Let me pull the shoulders down. Shot. The tip of the dilator is literally sitting inside the tear in the back wall of the disc, called an annular tear. That's where the herniation is. We've lost 2 drops of blood. The entire surgery is going to be done through this little tube right here. We're going to slide this 4mm tube down over the dilator, and I'm going to use the lateral x-ray to monitor the progress of the tube moving down. You can see there's some other things in that picture besides the spine. You can see the endotracheal tube, and you can see the esophageal temperature probe, which is braided. We're now at the front of the C5-C6 disc with the tube. Show us the tube at the front of the disc. I'm going to pass this tube down over the dilator through the front of the disc to make it go to the back. I need shots, Jordan. If I look up, you need to take a shot. Meanwhile, we're watching the tip of the dilator. You saw it move there forward about 1 millimeter. We want to keep an eye on that. And now the dilator moved backwards. We want to keep an eye on that as well. You don't want forward movement or backward movement of the dilator. Forward is bad and backward is bad. You want to keep it right there seated at the herniation. And Jordan, let's just take a shot. Let's take a quick front view so the audience can see what it looks like from the front. Any questions?
No current questions, but we do have a comment from Canes25 on YouTube.
Yeah, stay there. Before the comment, I just want to say, look at the tube. Jordan, you can move this to a lateral view. Jordan, show us the tip of the tube at the back of the disc. Put your arrow there. You can see it's off to the patient's right side. And look at the tear, the annular tear. It's a little black line right there. That's right. And then you can see the herniation. Yep. So amazing what you can see with the x-ray when you do a little discogram. So far we've lost, let me see that. This is what we've lost in terms of blood loss. You guys see this? Basically 2 drops of blood. These surgeries are virtually bloodless surgeries. All right, I'm going to advance this just a little bit more. Shot. And I'll take the question from Haynes 25. All right, that should be good. That's as good as we're going to get it. Great job. Yes, we'll take the question from Haynes 25.
From Kane 25, they said, Doc, my wife filled out the free MRI review. Tomorrow she will be sending out the MRI in the mail. I hope you can cure her with the cervical DLDR. I know you can. I just hope she's a candidate. Sir, thank you kindly. I don't want her to suffer like I have for so many years. So I told her she needs to talk to you. I finally got her to watch one of your procedures, and she's filled out the forms immediately after.
All right, wonderful. Well, it's good to hear that you have such a wonderful relationship with your wife. You care so much about her. Yes, if she's having pain, we can fix it. I just have to figure out where it's coming from. And a lot of people take that step for granted. Not you, but other people. Everybody seems to think that the MRI shows you where pain comes from. It doesn't. The patient shows you where pain comes from. And the physical exam is so important, and that's why we do everything the way we do it, with the Zoom, the MRI images. That's the information I need to make an accurate diagnosis. Trust me, if there was an easier, shorter way to do it, if I could just look at the MRI report and do this, I would do it. There's no, it takes more time for me to look at someone's MRI images and to do a Zoom call with them than just looking at why is the targeting light so red? I don't want it that red. It's too red.
You don't have to remove it from the soft on the left side?
Yeah.
That's how you do it.
Yeah, that's better. Keep going. That's good.
Thank you.
Yeah. All right, now I just need to sharpen up my image. So which laser are we using?
Oh, this is 60.
60.
Yeah, I'm pushing it. I'm sorry.
Yeah, it's fine. Fine, no problem. So this is the back of the disc, right where the herniation is. We're literally sitting at the back of the disc. And but Keynes 25, thank you for your confidence in us. And I will do my very best for her, of course, as I do for everybody, as a matter of fact. And we'll figure out where the pain's coming from. The good news is it's doable to figure out where the pain's coming from. And I tell everybody, the most important first step in curing back and neck pain is diagnosing the source. All right, I'm pulling back just a little bit. I want to get a better look at this. Keep the questions coming, by the way. I'm happy to take them.
We have a question from King Smooth on YouTube.
King Smooth, I like it.
They said, I'm waiting for insurance approval. That's it. I am suffering tremendously. How long will this surgery take? I have a herniation between C4 to C5.
Yeah, C4 to 5 herniation should be an hour-long procedure. It should be pretty quick. That's what I would expect. And yeah, insurance approval, I would just warn you about insurance approval. Insurance, we don't typically wait for insurance approval because it can be very hard to get ahead of time. My advice is don't wait. Your health is more important than insurance approval. I had a similar situation happen with myself. My insurance would not approve my sinus surgery even though it was obvious I needed it. So I went ahead and paid for it myself out of pocket, and then eventually what happened was the insurance paid for it. But we had to fight them, and then we got it covered. So just be aware it can be a beast trying to get insurance approval. The insurance companies are under a lot of fire lately because they are denying a lot of surgeries they should not be denying. And denial means, just for those of you who don't know, it means they either they deny paying the claim or they underpay it. They pay too little. And a denial for insurance from an insurance company for a health procedure is very common. Hospitals get them, we get them all the time. We have to fight them. I mean, that's what you have to do. And the insurance companies know that most people won't fight their denial, they'll just accept it. And so that's why they do it. They deny it because they can get away with it. There's no law that says the insurance companies can't deny a claim, okay? The laws allow them. They've written the laws to allow themselves to deny the claims. But if you call them on it and say, look, you're not supposed to deny this claim for the reasons you've denied it, then you can beat them and make them pay. So that's what we're hoping to do for a lot of our patients who got denials for their surgeries by the insurance company. We are fighting with our patients, for our patients, side by side, to get the insurance companies to pay for these claims. However, we can't guarantee they're going to pay. And the insurance companies, by the way, they don't cover what you need. They cover what they want you to have available to you. And what they want you to have available are surgeries that are highly invasive, bad surgeries. Because they realize that it's far better for the patient to say no to a surgery than for them to say no to a surgery. And if the surgery has a bad reputation, like fusion, then they'll cover it because they know the patients won't get it done. And then they don't have to deny it. They just let you deny it yourself. And that's how they work. So don't expect your insurance company to do what's right for you. Expect yourself to do what's right for you. Mm-hmm. That's my advice. From somebody who has insurance and deals with insurance companies every single day. Get yourself taken care of. Don't sacrifice your own health so the insurance companies can be more profitable. That's a big mistake. All right, so far great questions.
We have another question.
Uh-huh,
This comes from David on YouTube.
uh-huh.
And they said, I have two L4 and L5 is worse bulging discs. They
Okay.
want to do physiotherapy to improve it. Is this a Band-Aid to what I think is inevitable? I am 6'6" and 50 years old.
Wow, 6'6", you're a big guy. So the answer to your question is simple. Herniated discs, bulging discs do not get better with physical therapy. They get better on their own in time. So what the physical therapy does is it really forces you to stay active and not just lay around in bed. So, you know, I'll be honest with you, for many years we used to treat herniated discs by making patients lay in bed, called bed rest. And patients would lay in bed for quite literally weeks. And we realize now that that was the wrong thing to do. But so now we do the opposite. We put people in therapy. And what you're really doing is you're trying to let your disc heal. Okay? You're trying to let your disc heal. And the therapy itself will never heal your disc. Your body might heal it, but that's all. You're just basically buying time by being in therapy to allow your disc to heal itself, if it will heal itself. The only question is, will it heal itself? And the answer is long-term, no. You're going to absolutely have to have surgery, 100% in your lifetime. The only issue is, I don't know how old you are, but let's just say this is what insurance is all run by actuarials, by the way. And if you don't know what an actuarial is, it's somebody who studies numbers, probabilities, likelihoods. And basically what they're really thinking is, what's the probability that you're going to need surgery in a year? Like, Because if you don't get the surgery today, then in a year from now, you might not have that insurance. You might have a different insurance. And then it's somebody else's problem. As long as your current insurance doesn't have to pay for it, they're happy. They don't really care if you get better or not. I mean, sure, if you get better on your own, they're happy because they didn't pay anything. And then physical therapy, as you know, costs money. It's expensive. You got to pay for it. Plus, you got to go. It takes time out of your schedule. It's disruptive. And it really doesn't work at all. So the issue becomes, from the insurance standpoint, can I just keep this person believing that they don't need surgery for a little bit longer until we can drop them off our plan, or they miss enough work that their boss fires them, and then we don't have to worry about paying for them anymore. That's really what's happening. I am not joking. That is how the insurance companies see you, as somebody with, back pain and a herniated disc. Just hoping that it'll either get better on its own, which it does sometimes in some people, or that you will go somewhere else in a year and not be their problem when you need surgery, when you finally figure out you need surgery, okay? So from your standpoint, the question is, do you really want to wait a year, to get definitive treatment? I see people coming in here with 20 years of back pain from a herniated disc. And for 20 years, their lives have been robbed from them. They can't travel. They can't play sports. They have to call out of work a lot. So basically, their quality of life is really what you're betting on for the next few years, your quality of life. And the reality is do you want to give up the quality of life? And if you say, you know what, I'm perfectly happy every night coming home and just laying on my couch watching Dukes of Hazzards reruns, then by all means, don't get surgery. But if you're somebody who is tired of being in pain, wants to be fixed, wants to have an active life and not be restricted or limited by pain in any way, meaning not just that activity causes pain right away, like with the activity, but the next day, like, you don't want to have to pay for your activities the day before with bad pain the next day. You know what I mean? So you want to get rid of that pain. You want to get rid of that whole pain with the activity or pain after the activity mentality and just forget about it. And if that's the case, then you need this surgery right here. This is it. This is the best you can do. If there was a better treatment for those bulging discs that are causing your pain, I'd be doing it. But there isn't. The best treatment used to be a fusion. I used to do lots of fusions on people. Fusion, 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 all week long. Right, Luis? You remember those days? And then when we figured out that this surgery here, far less invasive, far safer, far better for patients, works better than a fusion, well, that's when we stopped doing fusions, really. We don't do them very much anymore. It's very rare you'll see us doing a fusion, very rare. The point is, the fusion used to be the best option. Can we turn the light intensity down just a smidgen? I wonder if I'm a little bit overexposed here. Yeah, I think that's fine. So to answer your question, the right thing to do to get rid of your pain permanently is to come here and let us do the laser surgery. That will get rid of the pain, okay? The wrong thing to do is to believe that, just put it off and believe it's going to go away with therapy, because it won't. It will go away. If it's going to go away, it's going to go away without therapy. The only reason we do therapy is to keep you from laying around in bed while you're in pain, and then you get worse. Because people that lay around in bed, we used to tell people to lay around in bed for 2 weeks. We found out that those people started getting other problems, like hip pain, knee pain. Their muscles would get sore. I mean, they got all kinds of problems just from laying around in bed. And it wasn't helping the disc problem at all. So we learned that as doctors that having patients lay around in bed was horrible. And that's all you want to do when you're having a flare-up, is lay around in bed. So what we figured out is you got to put people in therapy just to keep them from laying around in bed. So the whole idea of physical therapy for back pain is not because physical therapy fixes your back pain. The whole idea is to keep you from getting more problems as a result of self-treatment laying around in bed. I don't know if that makes any sense, but that's the God's honest truth. Now, the other thing you can try is a shot, like an epidural shot, but it's only going to give you relief that's temporary at best. I don't recommend it unless you're like, oh, I got to finish this thing for my job for the next 2 weeks or for the next month. I can't get surgery, right? I got work. Fine. Then get a shot, feel better for a little bit, but eventually you're going to be back having the surgery. The shots will never fix your problem, ever. And we used to do shots all the time. We recommended them all the time. We still do them once in a while. But the reality is shots don't fix the problem. By the way, this is the bone spur. And I am taking some of it out. I'm not going to take all of it out, because all of it's not causing problems, just some of it is. And the some that's causing problems, that's what I'm going to take out. But the part that's not causing problems, I'm going to leave it alone. Why, you ask? Well, because it's all about responsibility. I have a responsibility to do this surgery safely for this patient. And the more aggressive I am digging around bone spurs that don't cause any symptoms, well, if I cause a complication during that, that's on me. And I don't want that. I don't want to do that to a patient. All right, if you have more questions, I'll take them. If you don't, we can run another video. We'll show you guys basically how the Deuk laser disc repair works.
We do have a couple of comments and questions.
Sure.
This first one comment is from Canes25,
5 minutes.
once more on YouTube.
Uh-huh.
And they said she's having severe cervical headaches, neck pain, has a normal spine, 2 posterior herniations stick out like a sore thumb at the 4-5 and 5-6, the latter being the worst. But I told her you will diagnose her, and after you do, then we can start the process of getting her there.
Yeah, all right, very good. Well, I agree with you. Just because you got the herniations don't mean they're causing the pain. Look at that herniation that just came out of the foramen. That was sitting on the nerve root right there. You are correct, and I'm so glad that you've watched so many of my surgeries. You understand. You understand. MRIs don't make a diagnosis. Doctors do. And you need someone who understands this stuff to figure out where the source of the problems are. Okay? And that's what I can do to help you. That's bone spurs, by the way. That's scar tissue right there. This is all in the foramen, we call it, the neural foramen, right where the nerves are. I just need another minute or two and I'll be done. I don't see any more herniation. I mean, sure, there's a lot of junk in there. But a lot of scar tissue, bone spur, things like that. But I pulled back into the tear, and you can see just how much stuff there is here. This stuff is scarred up, that's why it's golden color. There's still a little bit of herniation here, but most of it's been cleaned out. The stuff that was sitting on the nerve has been cleaned out. Just for those of you who are new to watching, a lot of people think, oh, the MRI is going to look normal when we're done. It's not. That's one of the biggest misconceptions. I have never done a spine surgery or seen a spine surgery ever in the tens of thousands of surgeries I've seen and done where the patient's MRI looks normal at the end of surgery. So the problem is a lot of people think it's supposed to be normal. It's not. You're supposed to feel normal. You're not supposed to look normal, okay? We can't make a damaged body part look normal. It's not humanly possible. So what we do is we get rid of symptoms. And that's why actually an MRI is not the diagnostic tool. The best diagnostic tool for neck and back pain is the physical exam. And just going back to my old days as a doctor, as a medical student, and as a neurosurgeon who was young, and very well trained, by the way. We used to, you know, they used to tell us in med school how important the physical exam was. And to be honest with you, we would all laugh about it. Because we're like, you know, maybe it was important when you guys went to med school. These are our professors we're talking to. But, you know, that was like back in the 40s and 50s. And nowadays we have MRI scans, and we got CAT scans and x-rays and all these other really good diagnostic tools, right? So we would kind of make fun of the old timers and tell them that they didn't know what they were talking about. You know, the physical exam is so important, right? Ha ha. You know, maybe in your time it was important, but not to us. We got MRIs. And you know what I've learned? I have learned that they were right. And we were just young and stupid. And I got to tell you, there's nothing more powerful than a good physical exam at diagnosing the source of pain in a patient. Okay? And you got to have the MRI too. I get it. I'm not disagreeing. But that physical exam is so important. All right, we're sitting right on top of the nerve. That's the last of that bone spur I want to remove right there. I don't think it's doing anything at this point. The nerve's below it. There's a little bit of scar tissue here. I just got to be careful because I don't want to harm the nerve sitting underneath there. And the scar tissue is not going to do anything. It's going to be ugly. And of course, you're going to be able to see it on the MRI. But the reality is the scar tissue doesn't really cause too many problems in this area. So it was the herniation that was sitting there, right there, that's gone now. And I'm happy with that. I think the patient's going to be really happy with the results. I'm just going to take one more peek, you know, to look over here, make sure I'm not missing anything, and then we'll be done. This was a single level cervical herniation, C5-C6, happens to be the most common disc to get herniated. That's the annular tear I'm cleaning right there. You don't see any more herniation, just a little bit of tear, and that looks good. Right, Luis? All right, we're done. It went well.
Seating all, please. Thank you.
All right, I'm going to come and answer your question shortly. Directly, face to face. So you can see my pretty brown eyes. I can hang out with my boys, Henry and Sanjay over there in the conference room that we've turned into a broadcast room over the years. I'll show you the incision in just a moment so you can see. With the cervicals, it's small. It's 4 millimeters, you know, tiny. I think I was a little heavy-handed with the scalpel. I may have done 5 millimeters today. But either way, it's tiny and bloodless. We lost maybe 3 drops of blood the whole surgery. Let me show you guys. And just so you know, the patient's face, can you see this, Henry?
Yes, we
The
can.
patient's face is right here under these drapes. He's got a tube coming out of his mouth going to the ventilator. This surgery in the neck is done under general endotracheal anesthesia. All right, so let's see. Let me show you guys the incision. Yeah, like I said, I was a little heavy-handed today. Probably 5 millimeters. An extra 25%. Anyway, here's the Adam's apple. His chest is here. This is the left side of the neck. You can see little pieces of herniation flecked around. And that's it, folks. No bleeding, no trouble with complications. If he had a fusion done, ACDF, complication rate is 50%, 50%. With Deuk laser disc repair, we've never had a complication from the surgery itself. And I will be there shortly to come and answer your questions. Thanks for watching.
And good morning, I'm Dr. Artie Majan, CEO and founder of the Deuk Spine Institute. I'm here with a patient who has traveled here to have his neck fixed. He had a herniated disc. We did his surgery just yesterday.
Yes, sir.
It was outpatient, Deuk laser disc repair, endoscopic. How do you feel today?
I'd say probably 90 to 95% better, for sure.
Awesome. And what kind of problems were you having before that brought you here?
Severe balance issues, tingling in my arms and fingers. I had pain running down my leg, but I don't have nearly anything today. So big difference.
And your insurance covered your surgery, is that correct?
Absolutely.
And who do you have to thank for that?
Well, we've got you for one, and your whole staff has been friendly and kind, and you guys have always been on point with everything, getting back to phone calls and emails. It's been a hell of a process. Much appreciated.
You're welcome. And are you taking pain meds now that your surgery's over? A lot of people that have spine surgery, they're on painkillers for months afterwards. Are you on any painkillers?
No, sir, not at all.
None?
No pain enough to need pills.
Awesome. And you can see the small little incision. We went in with a 4mm incision on his neck, and we went through the front, back to the back side of the disc that was herniated, and we used the laser to clean out your herniation and get the pressure off your spinal cord and your nerves. Here you are now. Were you offered other types of surgery besides the laser?
I was a disc replacement of the C4, C5, I believe, and maybe C6. The recovery time was 6 to 8 months of no working, no lifting, none of that stuff. I chose to go with Dr. Deuk just simplistically of, his overall success rate and the transition of being able to get back to work and getting my life back.
Awesome. And you don't have a piece of metal in your neck?
No, sir.
It's all natural. We went in and used a laser to repair the disc, and there's no metal, no plastic, nothing left in his body. You get your natural spine. Anything else you want to say to your fans out there?
Hey, believe in Dr. Deuk and the Deuk Spine Institute.
Awesome. Thank you so much.
Thank you.
All right. Good morning, I'm Dr. Deuk Majan. I'm here with one of my patients who underwent surgery yesterday with the Deuk laser disc repair on his cervical spine. And he's here less than 24 hours from his surgery. And how are you feeling today?
I'm feeling great. No more neck pain, no more arm pain.
So you came to us here at Deuk Spine because you were having neck pain and it was going in your right arm and it was affecting your work, your quality of life, right? Tell us about that.
I first started noticing a lot of arm pain and a lot of weakness in my right side arm, and that's my dominant arm, so I knew something was going on. And then finally I went and saw my primary care, who took me to a MRI, and that's when I noticed that I had some issues going on. And he referred me to Deuk, and I'm very pleased that I didn't have to search around. I was real confident from watching all the videos and testimonials that I would be the right choice.
Yeah, and you can see in your surgery here, we made a tiny little cut on your neck in 2 spots. 4mm because you had 2 discs that needed to be fixed that were separated, and we used the laser to remove the herniations along with the endoscope. We did an annular debridement, cleaned up the tear that was there in the back of your disc. Everything went really well. You didn't have to have a fusion, did you? I mean, that's what most doctors will tell their patients. They need a fusion or an artificial disc.
Correct. I didn't have to get the aggressive plates put in. I'm real happy that it was just 2 little holes. That's it.
And it was outpatient?
Yes, I was home laying on my couch within an hour after the surgery. So
within an hour. Yeah, that was nice to be able to recover at home.
Yeah.
Not have to go to the hospital.
Correct.
Well, is there anything else you want to share with your audience?
My wife and I both came in a little nervous yesterday, and the staff just comforted us and very professional, very caring, explained everything from the beginning to the end. We were very pleased that we chose this route.
So what's life look like for you now that you got these symptoms gone?
I'm hoping to go sit on the beach this afternoon.
And you will. Very good. Congratulations on taking it and doing so well.
Thank you.
All right. Have a nice day. Okay. So our surgery was a 1-level cervical Deuk laser disc repair. Patient had a herniated disc in their neck with a little bit of an osteophyte or bone spur, and everything went really well.
I could see there was a considerable amount of scar tissue from the inflammation that had been going on for years. Bone spurs don't form overnight. Bone spurs take many, many years to form. And this patient had some pretty good sized bone spurs there near the inflammation, near the herniated disc on that right side at C5-C6. So I was able to shell out all the little pieces. There were probably maybe 8 pieces of herniation that I found, good 8. And there was some swelling in the annulus there. So hopefully he'll feel better right away. His symptoms were in his arm. I think he had some weakness, numbness, tingling in the arm. Had very little neck pain. So most patients do have a lot of neck pain when they have a herniated disc that's causing symptoms. He just didn't have a lot of neck pain, mostly arm symptoms. So hopefully it's going to be better. We'll see. Now people ask me, Dr. Deuk, when can I expect the arm symptoms, the nerve symptoms to go away? Really, it's just dependent on the patient. Everybody is different. I do expect the symptoms to go away. However, about 50% of the patients that have this surgery will have their symptoms go away today, the day of surgery. About 40% will have the symptoms go away by tomorrow morning when they come in and see us about 12 hours later, 24 hours later. That's 90% of the patients. About 10% of the patients having the surgery will have their arm or leg symptoms slowly go away over the next few months. And if you ask me how can you predict, I can't. I have not seen any way to predict. They all look the same in the beginning before surgery. Some of them have weakness, numbness on exam, reflex changes. It doesn't matter about the size of the herniation, doesn't matter about how many discs are herniated, which sides are herniated, how long it's been herniated, how long they've had pain, how much weakness there is. None of that really matters, except of course if you have spinal cord damage from the herniation, which this patient really did not have. But if that herniation had been a little bit over, maybe another 5 millimeters towards the center of the disc, then they would have had a spinal cord damage. Now what keeps that from happening? Most common places for herniations are not the center of the disc, they're to the sides. What's in the center that reduces the likelihood of a herniation? The answer is the posterior longitudinal ligament. The posterior longitudinal ligament is a really thick membrane, you can see it right here, that runs down the middle behind the discs. It's this white thick membrane called the posterior longitudinal ligament. And that thing reinforces the center of the disc and just off to the sides. So that the weakest area for herniation to happen in the annulus where it tears and herniates is actually the sides. And it could be a giant tear across the back. We've seen a lot of those. But in this patient's case, it was really just to the right side of middle. So anyway, surgery went well. You could see there were some bone spurs. We lasered some of them away. And once again, this was a single cervical disc osteophyte that we fixed. Okay, let's take some questions.
All right, this next comes from David, once more on YouTube.
Hello, David.
They said, logically, it seems, talking about their previous comment about their L4 and L5, saying, logically, it seems to get something down proactively instead of waiting to be, worse physical condition. And also, thank you, sounds like we may have in a future appointment. Flare-up is exactly that, just laying down. Now I live in Canada, and they only offer fusion, and I really don't want to do that invasive surgery. How much for surgery, non-insured ballpark price for L4-5, L4 to L5?
So David, first of all, thanks for being here. Thanks for commenting. You are correct. It's not just about an invasive fusion. Yes, I realize people are apprehensive about having an invasive fusion, right? I did 1,000 of these fusions in my career. Okay, that's L4-5 right there. The problem, David, is not just that you're now losing the movement at that disc, okay? You're no longer moving. It's now fused, right? You're moving above and below the fusion, but you're not moving at the fusion. So you've taken away normal movement in your spine, and you put more strain on the discs and facet joints above and below your fusion. What happens is those things wear out much faster after the fusion, and then you're back again for another fusion. If you go online and you read up about adjacent segment disease, you read up about multiple spinal fusions, what you're going to find is that there's so many people out there that are coming back after their fusion and getting more surgery, and they're living in pain, constant pain. Why? Because the fusions don't solve the pain. They just don't. It only makes it worse. And once you get that fusion done, it's like lighting a fire in a forest. It's only going to spread. It's only going to get worse. Lighting a fire is going to burn an area of the forest, and it's just going to keep going. And that's why so many people avoid fusion. It's not just that the fusion itself sucks and it hurts and you get painkillers for months afterwards. It's that they don't work long term. People are back in pain management, getting shots, getting procedures. Then they're back getting surgery. Then they're back in pain management. Then they're back in surgery getting a fusion. And it's a snowball effect, and it happens all the time. So the reason you want to avoid fusion is not because it's invasive. That is true, it is. You want to avoid it because it snowballs into more surgery and more pain and more suffering. It's even worse than you have it now, trust me. You want the Deuk laser disc repair. The whole reason I created this surgery was to avoid all the problems of fusions and have even greater success than fusion with elimination of pain in the back, the neck, or down the legs and arms. So the surgery doesn't just work better than a fusion at eliminating symptoms, but it's safer and it doesn't cause any long-term problems like fusion does. And patients don't need to keep going to pain management for the problem that we're fixing, which is the discs. So it's like the difference between a biplane, from the 1940s, a little airplane with a single engine and a little prop, versus a stealth bomber. I mean, there is no comparison. The technology is so advanced with the laser surgery. It's not just about avoiding the invasiveness of the fusion. As far as the cost goes, I don't deal with the costs. I'm a surgeon. I have my fees. My fees are about 5% of what people pay. They're very small, and they don't go to me. They go to pay my overhead, my staff, like Henry over here, and they go to pay the bills. So what's the overall cost? I don't know. The best thing to do is to get your MRI in and do the images, fill out the form, and do your Zoom call with me. I will look at your MRI, I'll tell you exactly what needs to be done, and then you will get not just an estimate, you'll get an exact what you have to pay. Okay? And we have a lot of Canadians, by the way. They all come here because they don't want to suffer, they don't want to have problems from the surgeries that are offered to them in Canada, and they just love the laser surgery.
This next question comes from Grace on YouTube. And they ask, does this surgery help with spinal stenosis?
Does this surgery help with spinal stenosis? Absolutely, Grace. This surgery treats spinal stenosis. So for those of you who don't know, what is spinal stenosis? If you look carefully here, this red thing represents a herniated disc, okay? And this space here, this hole, is called the neuroforamen. And spinal stenosis is narrowing of the neuroforamen. It gets narrow. What's narrowing it is the herniated disc. So by me coming in and removing the herniated disc, I am making more room. I'm treating spinal stenosis. That is how you treat spinal stenosis. What your doctor may offer you is a laminectomy. Horrible, horrible surgery. Highly invasive, bloody, dangerous, kills your muscles, permanently destroys the back of your spine, and it creates all kinds of problems down the road. You're going to be back for more pain management, back for more surgery if you have traditional laminectomy done. I would strongly recommend you come and get the Deuk laser disc repair. It is truly the best treatment for spinal stenosis.
Next is comments and just praise from Sunil Patel on Facebook.
Hello, Sunil.
And they said, nice doctor and staff. You are my most favorite doctor in my life. God bless you and more power to you. My nerve symptoms go away after 9 months. grateful to Dr. Deuk. He exactly told me around 8 months to 1 year. I've had my I had an L4 to L5 on January this year. I am completely pain-free today.
God bless you, Sunil. I'm very happy for you and your family, and I hope you stay pain-free the rest of your life. But you're welcome. We're very happy that you're commenting.
This next question comes from Jamie on YouTube, and they asked, I did find out that you're in my Aetna network. Do you do pre-authorization?
Yes, Janie, we do get pre-authorization if you have non-Medicare Aetna, which I assume you do. We will submit for pre-authorization. Your insurance will likely deny the surgery, and you will get it done, and we will bill your insurance, and we will fight Aetna to get them to pay. But that's how it works. Don't expect Aetna to prior authorize your surgery. People don't seem to understand insurance and how it works. If we got prior authorization from Aetna, it's a coin toss. Let's say they did prior authorize your surgery. Let's just take a one scenario possibility. We submit for prior authorization, they prior authorize it, you get the surgery done, we bill Aetna. Aetna will then deny payment saying, this surgery that you're doing doesn't have a CPT code that we cover, we're paying $0. At that point, we have $0 for your surgery, even though they prior authorized it. Prior authorization is not a guarantee of payment. When they prior authorize surgery, it doesn't mean they're going to pay for it. They may pay nothing for it. And we cannot take that risk as a company. Our overhead is too high. We would go out of business in a week. So patients have to pay a deposit. Everybody that you watch have surgery here has paid a deposit. And the deposit is going to be some amount of the full charge. So we have a full charge. You have a deposit, which is a smaller amount. We need to collect that deposit before you get surgery. The other scenario is that Aetna denies the prior authorization and says they won't pay. We do your surgery, we bill them, they pay, or they deny it again, and we have to fight them to get them to pay. There's a process called the appeals process. We're very familiar with it, and we have to use the appeals process to get them to pay. My advice to you folks, do not use what your insurance company pays for as the determination of what you get done. You are far too important. Do not let an insurance company that doesn't want to pay for anything decide what you should get done for your body. Sure, if you have a roof that's been damaged and the insurance company doesn't want to put on a nice, good, solid roof for you, they want to go cheap on your roof, maybe that's okay. You could probably live with that. On the other hand, if your insurance company wants to go cheap on your spine, I would not let them do that, because you've got to live with your spine the rest of your life. And the surgeons and the surgeries that your insurance will cover are probably not the right surgeries for you. So you have to make a decision in life. Am I worth it? And when you go buy dinner for yourself, or you go buy a car or a house, your insurance company doesn't pay for those things. Sure, if you don't eat your food, you're going to be unhealthy, right? So you could argue that where you go for dinner is important. Your insurance company should pay for it because it's a matter of health, right? Eating at McDonald's, after all, is not going to be as good as eating a salad every night. But your insurance company will not pay for your dinner, your lunch, and if you don't eat those things, you will be unhealthy. So don't think of insurance companies as covering everything you need to stay healthy. Think of insurance companies as businesses. They want to take your money every month as a premium, and they don't want to pay for anything. And the more they get away with that, the more profits they make at the end of the year. Remember, insurance companies take your money as a premium every month, and what they claim as their profits at the end of the year, at the end of the quarter, is what you don't make them spend. So what do you think your insurance company is motivated to do? Take care of you or keep your money? But if you need help with that one, then I can't really help you.
This next question comes from Arnold on YouTube. And they said, can nerves be damaged so bad that surgery is impossible?
Arnold, so the question is, can nerves be damaged so bad that surgery is not possible. No, if you have a problem in the spine that requires surgery and the nerves are being damaged or crushed, your best chance of recovery is going to be to get the pressure off the nerves. Always. The best chance of neurological recovery is going to be to get the pressure off the nerves. So there's no way a doctor, any doctor in the world, can predict how you're going to do with surgery with respect to nerve damage. There's no doctor in the world that can predict that. Now, there are some cases that are extreme, right? Let's say you fall off a cliff and cut your spinal cord in half. Well, there's no surgery that's going to fix that, period. But that's rare. And the most common problems people have are spinal stenosis, nerves that are being pinched. And my advice in those situations is go to a good surgeon. That's the key, folks. If you don't go to a good spine surgeon, you're not going to get good spine surgery. There is no standard way of doing it. For those of you that think spine surgery is like buying a Honda Civic 2023, you are just wrong. Every single spine surgeon, if you took 10 of them, 10 spine surgeons, they're all going to do your surgery differently. And there's going to be the one that does it the best, which gets all the pressure off the nerve, does it safely with the least amount of bleeding, the least chance of complication, and then you're going to have a horrible surgeon who literally just cuts you, looks in there, says they took the herniation out, but they never did because they don't know what they're doing. And they exist. There's lots of them. If you don't believe me, go watch this Netflix movie called Dr. Death. It's a neurosurgeon who was killing people, okay? And by the way, he's just an extreme example on the back end of the bell-shaped curve. There's lots of doctors that are just like him that are horrible surgeons that people are going and getting surgery from. My advice to you, you want it done right, you come to Deuk Spine Institute. We are literally the best in the world at doing degenerative spine surgery, which is pinched nerves, okay? We're not the best in the world at tumor surgery. We're not the best in the world at fracture dislocations. We're not the best in the world at spinal infections, treating those. We're not the best in the world at brain surgery. There's a lot of things we're not the best in the world at. But the one thing we are is minimally invasive surgery of the spine to treat herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, slip disc, prolapse disc, spinal stenosis, radiculopathy, sciatica, neurogenic claudication, nerve root compression, and annular tears with disc bulges. That's what we do better than anybody else.
This next question comes from Phil on YouTube. And Phil asks, how can you tell by looking at an MRI where my pain is? I don't think you can, correct? Regarding herniated disc L5 to S1, my surgeon recommended one level of fusion to the L5. Removing that material reduces the integrity of disc. Therefore, he recommends fusion. He said disc is like a flat tire.
Yeah. So Phil, number one, you are absolutely correct. I cannot tell you where your pain's coming from by just looking at an MRI. That's why for me to make a diagnosis, I don't look at an MRI. I look at the patient and I look at the MRI. So I do a Zoom call on my MRI review with everybody that submits their MRI, completes the form, and submits their DICOM images. I actually sit there and review your MRI after I examine you and talk to you, and I can figure out where your pain's coming from with about 95% accuracy just through Zoom, literally a 5-minute Zoom call, and your MRI. I do this all the time, and it works. And people fly here from all over the country, all over the world. They get their back surgery done, and they do very well. Okay? So, as far as your flat tire, your surgeon is not giving you accurate information. You do not need a fusion at L5S1. If you want to get a fusion, by all means go ahead, but you're being suckered into a fusion. What you really need is the surgery that I just did. It's called the Deuk laser disc repair. It's going to be the safest surgery for you It's going to give you the very best result possible in the world, better than fusion, better than anything else available. And it's going to have you back on your feet within a few hours, back to work and life by the next day. Okay? And by the way, no narcotic opioid painkillers with the Deuk laser disc repair. If you have a fusion surgery done, you're going to be on painkillers, addictive painkillers that kill people. You're going to be on them for about 2 to 3 months. Usually, that's the average. Okay? If you have a fusion, you don't want that. You don't want the painkillers. You don't want the big incision. You don't want the fusion. You don't want to lose movement in your spine. You don't want all the tearing at tissues and bleeding that goes along with fusion. You don't want the scar tissue. You don't want the adjacent segment disease. You don't want metal in your body or plastic or even cadaver bone. And that's what they do. All right? We fix this naturally. You don't have a blown tire. You have a tear, and it can be repaired with the laser. So don't let anybody brainwash you into believing you need a fusion. Consider yourself warned.
And then our last question for the day for the surgery is from Grace once more on YouTube, asking, how will I be out of work if I go and have spinal stenosis surgery?
Grace, your great question. I believe you're asking, how long will you be out of work if you go and have spinal stenosis surgery? Are you talking about here at Deuk Spine having surgery?
That's what I was asking.
Or somewhere else? If I do your surgery, you'll be out of work for 1 day. You can go back to work the day after surgery if you want to. We have patients who do. But I don't know, if you're traveling here, you're going to need to fly home the next day after surgery, and then you can go back to work the day after. So generally speaking, if you're flying into Orlando at Deuk Spine Institute, you're going to be out of work for 3 days. And if you want to take a full week, go for it. We'll give you the paperwork. On the other hand, if you're chomping at the bit to go back to work, we have people start going back to work the next day. If you're talking about somebody else doing your spinal stenosis surgery, how long are you going to be out of work? Yeah. It could be a couple of weeks, it could be a couple of months, and it could even be a couple of years. I've seen it all. I've seen people have spinal stenosis surgery elsewhere, and they never go back to work because they're permanently damaged from the surgery. Very common problem. I would not get it done somewhere else. Dangerous.
That is it.
All right, I hope you enjoyed our time together. I have. And for those of you who are new to our channel, understand something. I'm a neurosurgeon that specializes in the most advanced spine surgeries in the world. If there was a better surgery to be done than what we're doing, we'd be doing it. We'd be doing it here. But there isn't. That's the whole point. That's why we do this surgery every week, every day of the week. You'll see us do this endoscopic surgery over and over and over again. Why? Because it's so much better than every other option out there. That's why we do it. That's why people come here for it. That's why we have patients that contact us, like Mr. Patel, that let you know that we did their surgery a year ago and they're doing fantastic. Thank you for joining us. Have a great day. We have a Deuk plasma rhizotomy next. This is a patient with neck pain. By the way, he's had a fusion already. I did not do his fusion. He's traveled here from, now he may be the one who's traveled here from Michigan, actually. He may be the one who traveled here from Michigan or California. I can't remember which one. But he has a fusion, and now above the fusion and below the fusion in his neck, he has arthritis and severe pain. He can't turn his head. It hurts too much. We're going to be fixing that today with the Deuk plasma rhizotomy. You guys will not see it because we're doing it in operating room number 2, and we don't have a camera in there to broadcast. We only have it in one of our operating rooms. So I'm going to go fix his neck, and then we'll be back at the end of the day for a thoracic Deuk laser disc repair. A patient who's traveled here with multiple thoracic disc herniations. And I think he's from California. And I'm going to go in and fix those disc herniations.